Aloha, welcome to Healthcare in Hawaii. I'm your host, Josh Green, Senator from the Big Island, ER physician. Today I'm joined by a good friend, Dr. Scott McCaffrey, or I'll call him Dr. Scott because we're so familiar with one another. He's the incoming Hawaii Medical Association president, sworn in this last Saturday. Congratulations.
Thank you very much, Senator.
Good to see you, Scott.
Great to be here.
A few things about Scott, and then I want him to tell us about himself. Occupational and emergency medicine, family practice trained, University of Colorado, president of the Honolulu County Medical Association, and then you elevated to the presidency of the Hawaii Medical Association.
Yeah, actually it's the Honolulu County Medical Society, which I actually did 2 terms as president there with about a 6-year gap between.
Yes.
And then on now to be fortunate enough to be elected by my peers to be the president of the entire state, which is all the component medical societies of each island, and also some subspecialty component societies in various specialties like neurosurgery, orthopedics, and so forth. So Hawaii Medical Association really speaks as a unified voice for the doctors of the entire state. And we have a direct affiliation with the American Medical Association nationally, and there's a lot going on there as well. So it's a real honor to be elected to this position, and I'm all fired up and ready to serve.
Well, you're going to be a firecracker of a president, no doubt, based on the past. So we're really lucky to have you. You just got sworn in on Saturday. Why don't you tell us a little bit about the festivities, who was there? Because I think people need to get an idea of really the breadth, how many physicians you're bringing together. And like you said, it's a unified voice, but there was a lot of energy in that room. Could you tell us about it, Scott?
Well, it was high energy. First of all, there were over 400, or almost 400 people, not quite. And in addition to a whole lot of doctors that are members of the Hawaii Medical Association, we had folks from the political spectrum, regulators. Also very meaningful to me is they flew in the president of the American Medical Association to swear me in.
Oh, that's cool.
The other thing I find meaningful and that drives me and excites me is that the Hawaii Medical Association, many people don't know, is a 160-year-old organization. It was founded by King Kamehameha IV and 4 Maui doctors in Lahaina, which was then the capital, of the island. So there's a lot of history here that I personally feel, and it kind of moves me to make sure that I stay on track here and hopefully take the organization to the next level. We're all just going through. It's not about me, Dr. Green. It's really about the office itself and what hopefully I can bring to it to help further the cause of, which is our main mission, is to bring better health to the islands and a more safe environment for people to live in.
So you've been a very significant advocacy group for patients and for physicians. And then it's really interesting to me because I know that you had, for instance, you had the dean of the medical school there, and you had leadership from all the other organizations, and then the head of the whole national organization. What was it like to have the head of the American Medical Association in? What was that person like?
Well, as I said, it was very meaningful. Andrew Gurman, Dr. Andrew Gurman, he's a hand surgeon, and he has served at the national level for a number of years, was Speaker of the House of Delegates of the AMA, and worked his way up that way. And he brought the national perspective, going around and swearing in a lot of other local presidents of different states. So that's a nice kind of national perspective that sometimes we don't get enough here in Hawaii.
Right.
In addition, there was another gentleman that was the chair there, a doctor who was the chair of the the American Medical Association's Political Action Committee. So there was a lot of politics that were discussed as well.
Yes.
Which, as you know, in today's world, healthcare seems to be getting more and more political.
Yeah.
Obamacare, et cetera, and a lot going on here locally as well as nationally.
So is that one of your roles, Scott? Is it to represent us from the state of Hawaii, to express the challenges that we have here with healthcare, and to be able to tell these delegates and these political individuals and even the president, look, these are the fights we're having out in our state. Can you advocate for us at the federal level? Can you advise us on how we might proceed when we're dealing with insurers or, the political system or the hospitals? How does that work between you and the national guys?
Well, there's a direct link. As president of the Hawaii Medical Association, I am automatically a delegate to the national scene as well.
Okay.
So there'll be that kind of interchange going on and communication. But locally here, as far as my vision and goals as president for 2016 is to address what is, in my opinion and many others, the #1 problem in healthcare in our state here in Hawaii, and that is a shortage of doctors here that is projected right now, and this is according to Professor Kelly Withy's work at the John A. Burns School of Medicine. She's been studying this for over 10 years, that we currently have a 500 doctor shortage on a per capita basis for the people of Hawaii that is projected, if this continues and it's trending in the wrong direction, will actually be over 1,000 doctors short for the state of Hawaii by the year 2020, which is only four years away. I don't know if the folks out here listening to this show or watching have had any problems finding a doctor that'll take care of them. If you're here on Oahu, it's not as difficult, but you get to the neighbor islands, it becomes quite difficult to find a doctor, and especially specialists. And I'm sure you could comment on this as an emergency doctor, full-time. I don't know how you do it, by the way. You're a senator and full-time ER guy. What are you, Superman? But maybe you could comment just a little bit about what it's like on the Big Island with respect to not having a neurosurgeon right there when you need him, when a horrible head injury comes in, and you're on as the ER physician.
Yeah, that is really kind of, I'm so glad you're focusing on that, Dr. Scott, because every single weekend, that's what I'm seeing. This past weekend, thank goodness I didn't have any head injuries to treat, but every head injury goes off island. But even the basic things that matter. I had a 25-year-old Hawaiian gentleman who came in with pretty obvious ruptured disc, and I didn't have a back surgeon available to him. This was on a Friday night, and he would have to ultimately get transferred over to Honolulu for his surgery. And as you know, if you let some of these things, fester, or any certain problems just go on too long, people lose function, they lose capacity, and I mean, across
they don't call it emergency medicine for nothing.
That's right, and you've lived your life in that field. Why don't you? I think for perspective for people and how lucky, so they know how lucky we are to have you as our president going forward. Why don't you tell them a little bit about you've had a broad practice, really a large presence in healthcare for many years. Tell them a little bit about your operations and what you provide.
It didn't start out broad. I'm Boulder, Colorado native, went to school at the University of Colorado in Boulder, and then on to medical school in Denver at the University of Colorado Health Sciences Center. Trained in family medicine there. That was my first specialty. But then I fell in love with emergency medicine, as I think you did too, because for a lot of reasons. The drama of trauma, the excitement close to the street. I always really enjoyed that. I don't do emergency anymore. I did for 15 years. But that was my first big career.
Yes.
Actually worked in some very intense places in northwestern New Mexico, the San Juan Regional Trauma Center there. And did a lot of that, and it was fabulous and wonderful. But when I moved here, one thing I found lacking a bit in emergency medicine, is probably the only thing I don't like, and that is you're treating and taking care of people and saving lives, but you don't get follow-up then with this, like the wound you stitched and took so much time. You don't always see the outcome of that.
Right.
So what I did when I moved here is started a private practice in trauma, and coupled that with occupational medicine, which is helping employers and insurers as well focus on injuries that happen at work and what we can do to get them better and get people back to work as soon as possible to minimize the impact of the trauma. That's what I've been doing at the WorkStar Injury Recovery Center out at what is now the Queens West Medical Center for the last 25 years. I did some other things in between. I started the Kaiser. I've been fortunate to work in both an HMO, kind of more of a structured environment, and as a private doctor in a fee-for-service world. That was the WorkStar. But before I did that, I was the chief of occupational medicine for Kaiser Permanente and set up their OCMED program in 1986 and was there for about 5 years. It was a wonderful experience. I love Kaiser and miss those days as well. But it's been a great journey, and I've had kind of a broad-based experience, and I've looked at healthcare, the whole healthcare, watched it evolve into the current environment we live in right now. I was back trained in old school, and this was a time, by the way, when and I remember this at the University of Colorado. You know how you're up all night when you're in training, and maybe take 12 new patients from midnight till 8 in the morning, and then you have to prepare to present the case to some very disciplined and sometimes some kind of drill sergeant type doctors in the morning. Mm-hmm. And I remember at that time, if I had gone in the morning and talked about patient Doe or Jane coming in with whatever problem, and said, if they asked me, well, did you order a serum porcine level or some exotic test that might have had a clue as to what was wrong with them? And I said, no, sir, I didn't, because I didn't think it was cost effective. I would have been drummed out of that program like that. Mm-hmm. Seriously. Fast forward to today, which is, and you know, all the changes we've seen in healthcare, everything is so cost-driven now. These questions are coming up all the time, and I have mixed feelings about that, of course, because one thing that attracted me to go into healthcare is the sanctity of a single life. You know, rich man, poor man, beggar, thief, and one of the beauties of our system is it has held that high esteem and that high bar of moral value to it. What we're seeing now, unfortunately, in my opinion, is a lot more of a cost approach to it, and in the process, I think we're losing a little bit in our profession and maybe a society as well in terms of the value we put on even a single human life. And so that's one thing I'm going to try to do is keep everyone understanding those old school values. Everyone, when you sit back from a public health standpoint and start to look at cost effectiveness of medical resources and so on, it's pretty easy to say, yeah, let's trim here and cut there, and maybe not offer this service, and maybe we don't need to do this type of treatment here because it's not cost effective or whatever. That sounds really good from that big picture standpoint, but you know, when it's your life on the line, or your loved one, or your child, people will do anything and pay anything. And you know, cost goes out the window to do what's right for the patient at that moment in time. And that's a value I want to make sure is kept before the public, and because I do think that in that way I speak for the public.
Yeah, well, I think it's extraordinary that you're able to bring that perspective to it, Dr. Scott. I mean, and you're not coming at it from the perspective of someone who hasn't seen patients. You've now seen patients for 30, going on 40 years probably.
I haven't seen it all, but I've seen a lot.
Yeah, well, you get to see a lot when you see people in the ER, as we've experienced, and when you get to see people trying to recover from injury. And those are some of the most long-lasting challenges in life, and definitely they impact not just how you feel and the pain that you suffer, but it impacts the family and it impacts the ability to work. And I think that perspective that you bring is going to be very important because, and I say this before we go to our first break, if it's only the perspective of the insurers or only the perspective of the pharmaceutical industry or only the perspective of the hospitals, then we will always see an overemphasis on cost and return on investment. And you come at it from the perspective of what is the investment in a human being. And I think that is really what we want to see from physicians, and I can't imagine anybody better.
Well, thanks so much. And I hope I can live up to that. But that's not the entire picture. You see, I don't think that cost control and getting people all the care they need are mutually exclusive. I understand in some ways there is a limited pool of money, but when you look at the inefficiencies that are built into our current system, you know, right now, 19% of our gross domestic product versus other countries with comparable or arguably better healthcare systems spending only 10. There's a lot of inefficiencies going on, and if we can get rid of those by working together with stakeholders from all sides of this equation, there could be plenty of money to provide the very best care for every person.
Okay, well, you heard it here first. Healthcare in Hawaii, hosted by me, Josh Green, ER doc and senator. Got the HMA president, and he's going to help us solve our problems because he knows the value of patient life, but also is reflecting on the need to make sure that we can afford it here in our country. So thanks for joining me.
We can do it.
We're going to see a break, and then we'll go to our next 15-minute segment. Again, I'm here with Dr. Scott McCaffrey, incoming president of Hawaii Medical Association.
Hi, my name is Cindy Matsuki, and I host the show High Growth with HTDC on ThinkTech Hawaii. This is the show where we talk about all things tech, innovation, entrepreneurship, and manufacturing, because there's so many things going on in Hawaii and more people should know about them. So this is the program that you can come and find out about all the things happening in Hawaii. And this show also airs on Olelo 54 along with ThinkTech Hawaii. And it broadcasts live every other Tuesday at 3 p.m. So don't forget, check out the show Tuesday, 3 p.m. every other week. High Growth with HTDC. Thanks.
Aloha, this is Reg Baker and I am the host of Business in Hawaii. We talk about positive stories of businesses in Hawaii, how they have been successful and how they have overcome some of the obstacles that a lot of us encounter when we try to have a business here. And believe it or not, there are a number of positive stories here and we want to talk to all of you. So we broadcast live every Thursday at 2 o'clock. And it rebroadcasts again on Olelo Channel 54. So I sure hope to see you next time. Please tune in on Thursdays at 2 o'clock. Thank you.
You did trick me.
Aloha, welcome back to Healthcare in Hawaii. I'm Josh Green, your host, Senator from Big Island. I'm joined today by Hawaii Medical Association President, just freshly inaugurated this Saturday, Dr. Scott McCaffrey. Good to see you again, Scott.
Thank you.
So in our first 15 minutes, Dr. Scott was able to really wax philosophic in a good way about what he hopes to be able to bring as a physician, as a practicing physician in the ER, in occupational medicine, trained in family practice, to the dialogue. But there are so many issues, as we were talking about in the break, hot topic issues. So I wanted to just, because Scott loves to have a good back and forth, I wanted to get your opinion, Scott, on multiple challenges that have kind of emerged over the years that you've shared with me in our healthcare system. Would that be all right?
Sure.
Okay, let's go with controversial right off the bat. Death with dignity. This is an issue, some people call it physician-assisted suicide, others call it death with dignity. This issue has apparently come back again to the state of Hawaii. How do you feel about it? Tell our audience what it would mean to you.
President Andrew Gurman, when he was here, the AMA president we were talking about in the first segment,
Right.
took me aside after I was sworn in and we went out for a scotch afterward. He
Yes.
said, remember, McCaffrey, he said, you're no longer speaking on your own behalf. You're speaking for the Hawaii Medical Association as well as the AMA to some extent. So
Yes.
be careful what you say.
Yeah.
So, I mean, with that lead in, I think what I'm going to say about this is very consistent with our both local and national opinion, is that doctors should not be pushing the button or pushing a plunger or giving directly to cause a person to die. It is so antithetic to our history and our upbringing. And like I said, whatever it takes, no matter how much it costs, where the person is from life, from if they're homeless or somebody living in Kahala, you go for it and you don't stop. And you as an emergency doctor, I think you understand that.
Yes.
Yet having said that, I had experience back in my residency where I was taken into a back room. We had a very sick person. This was at the VA hospital, by the way, and I was taken to the back room by my resident and one of the attendings and said, look, this patient's on their last leg. They're in a diaper. It was a very elderly individual, going the wrong direction. We could keep him alive for another week. But maybe we ought to not try so hard here and allow nature to take its course. And we did. And that was the humane and right thing to do. But we didn't do it without talking to the family. To me, one problem I've got with the whole death and dignity movement, and I understand that it needs to be focused on, and people, God, poor people that are suffering probably need to have access to it for certain types of diseases. I get that. Yet doctors have been helping people leave the planet for as long as our profession has been around. It's been a very private thing and a very intimate thing. And I think to make a circus out of it is in some ways not necessary. That good doctors everywhere for as long as time has been recorded have been helping people pass when it's time.
Yes.
Now, no one can, of course, we're in the litigious world we're in and so forth. You start saying, yeah, I helped this person out. I guess you potentially could be set up for some legal problems. But if you do that in the correct way, and the family's all, that you're doing with the family as well as the person, by the way, anyone listening, make sure you have a healthcare directive, that you don't want to be kept alive with extraordinary means of artificial life support when your time has come to go. It's one of the best things you can do for your family and for everybody, really, and yourself as well.
So you want a living will.
And the time to do that, by the way, Senator Green, is to do it when you're healthy and feeling good, not when you're kind of struggling to hang on, because you want to do it when you're thinking right. Don't get me wrong. If I'm going down, I want a full court press at first. But if the writing's on the wall, I'm personally hope somebody will trip over the cord to the ventilator.
So we
for me, you know.
I knew we were going to have a colorful conversation, no doubt. Okay, so physician-assisted suicide concerns you because it crosses a line based on the Hippocratic Oath. How about hospice support and palliative care?
Are you kidding? Hospice? I think that's the closest thing we have to angels here on earth, is, in my opinion, people that work in hospice, because that's tough work.
Yeah.
You know, I was really fascinated with oncology and treating cancer, because I had a couple of great, fabulous professors and mentors when I was going through training. But I personally found I didn't have the emotional strength to deal with that much terminal illness where you couldn't. And that was back when we didn't have a lot of good treatments for cancer. Yeah. So it was many, if not the majority, it was a death sentence when the diagnosis was made. I just didn't have the fortitude. But these hospice workers, man, I mean, they get in when the going gets rough. They run to the football, and I'm like, you know, I'm kind of like getting sweat. I just don't think I can do that like they do, certainly. And so I think it's a wonderful thing. It ought to have plenty of funding, and I think those are some of the heroes of our community and humanity.
Would you say that that's a good space for people to have the dialogue about physician-assisted suicide in the space of hospice care and palliative care instead?
Well, I can't advocate physician-assisted suicide. It doesn't fit with my own moral values, and it certainly isn't something that's endorsed by either the AMA or the HMA. Yeah. So I'm not for that. I would much rather give a shout to hospice. Yeah. And you know, and it's a private matter between the family and the doctor and the patient. Yeah, and I think that's wise in many ways. I think what people may not realize is, when we're in the hospital, when we're in the emergency department, these conversations do take place, and people know, I think very naturally, how close they are to passing, and I think we don't give people enough credit a lot of the time. They do have these conversations with their physicians, and they do have the capacity to know when they want to back off on care and naturally pass. And there is already a very, very intricate system that exists between doctors and patients and nurses. And the system does handle most suffering. There are people out there that will suffer toward the end of life, but we can do quite a lot now with palliative care. Yeah, and there's two components to it too. You know, there's a technical piece and an emotional piece. Emotional, you've treated people with profound depression. Yes. You know, people, if you get depressed enough, you want out, you want to go, but and Robin Williams might be an example of this, to take your life at that low moment. The thing about endogenous and exogenous, what they call endogenous and exogenous depression, is it's treatable. Yeah. And you pull people through their darkest hour. They come on the backside and be happy, you know, and thank you for it and be happy they're still here. That happens all the time. So we got to be careful that we don't succumb to a depression moment. Yeah. The other piece, and we've seen this with some of the lethal injection, intentional executions that have gone awry here in the United States. Our Creator made us as real survival animals, and even though it may seem like it's time for us to go, that's a problem they're having in Oregon and giving the black pill. You know, well, just give the person a pill, and that's good, but you know, sometimes that doesn't do it, and then the person is brain damaged maybe because of a failed attempt, and then what are they? They're bound to a hospital bed on a ventilator. This gets very complex. It sounds good on the surface. Death with dignity. Who can argue with that when it's phrased like that? Of course, you want death with dignity. However, the mechanics of it, and you get all these other factors involved, and it get a lot more dicey and uncertain, and can have some untoward, unintentional consequences that you don't really want.
Well, it's going to be fascinating because I think that this may be an issue that has a national dialogue this year and going forward. So as HMA president, we're going to see you there.
I'm in.
Okay, let's move on to another easy one, medical marijuana. Medical marijuana.
I'm not so sure that's so easy, but keep going.
This past legislative session, the legislature decided that they would authorize medical marijuana dispensaries. How do you feel about medical marijuana in general? How do you feel about dispensaries? What do you think the role of the physician community should be on this matter?
I'll say this about cannabis. I think it is a very powerful substance. I think it has already shown itself to have therapeutic value. That said, in a number of areas.
Yes.
It is also unfortunately, one of the most understudied, underexamined substances that we come in contact with. And interestingly, I find it very interesting, now we're going to dispensaries here finally, after 13 years of it being okay to have medical marijuana. Took us 13 years to get to dispensaries, unlike most of the other states. But now we're finding ourselves as a medical community here, I think finally having to roll up our sleeves and grapple with it, and properly so, as the powerful medication and substance it is. You cannot think of this as an innocuous drug.
Yes.
Because there's usually two ways that people take it. They'll either be trying to smoke it,
right,
or they'll be eating it,
right,
usually through a food like a brownie or a cookie or something like that.
Right.
Well, the smoking way is actually, and a lot of people don't know this, it's actually safer than taking it through your mouth, because when you're eating like a marijuana brownie or something, you're putting all that substance into a closed vessel.
Yes.
When you're smoking it, the partial pressure of the cannabis only gets so high, and your blood equilibrates at that level, which isn't a real toxic range. Although some of the new strains they have, and I want to address that, are you got to watch out. So you got to watch out eating. You have to be very cautious when you're taking it by mouth. I have seen cases where people have been laid out. I mean, just sick, toxic, passed out, vomiting.
Yes.
Any medicine or substance that has therapeutic value can cut a negative direction.
Yeah.
And you can apply that to any of the medicines you and I prescribe,
right,
on a daily basis, and cannabis is no different.
Yeah, we've had this the beginnings of this debate already. Just 2 weeks ago, maybe less, 2 children ingested a significant amount of oral cannabis through a fruit roll-up or something like that had been brought in from another state. And I'm concerned personally that we put the cart before the horse, so to speak. And if we bring in too many edibles and we allow them to be marketed as chocolates or cookies or things that kids really like.
And leave them around the house, and your kids, kids love candy and stuff. That's another whole aspect that needs a lot of public education.
So, but you're okay with medical marijuana for pain and for nausea and for AIDS and so on?
Well, I'm as okay as I can get, considering it's still illegal at the federal level. It's such a conundrum.
Yes.
Because we have a medication here that's also used recreationally, and can lead to negative problems there with driving and so forth. But we've got this powerful thing that we're saying is going to be good for certain people, but heretofore, the way, and being from Colorado and going back and visiting relatives and friends there, I know this for a fact, talking to folks there, that the people that have been giving medical advice on what you should do, you come in, wait, you got a headache, are the dudes behind the counter in the cannabis shops.
Yeah.
And that's about the extent of the medical profession's involvement with it. So it's a very powerful substance. So what I'm advocating here is that we doctors here have got to roll up our sleeves, get in, get educated. We've got to call for more research here, or nationally, whatever, but it needs to be studied further so we can understand not only the benefits, but also the toxicity range.
Yes.
And therefore prescribe it like we would any other medicine or pill. It's all about dose and frequency, and cannabis is no different.
Yes. It's just so fascinating. I knew just 2 small issues and I would fill up a 15-minute
Are we running out of time?
Sure. We're going to take a break, and then we're going to come back, and we're going to continue with medical marijuana, start talking about opioids and your vision for the state.
Excellent.
I'm Josh Green, Healthcare in Hawaii's host. Thanks for joining us.
Aloha, my name is Jim Shawn, and I'm host of a show called Education Movers, Shakers, and Reformers. Each week, live streaming at noon on ThinkTech Hawaii, we interview people who have special insights into education, from early education through K-12, all the way through higher education and beyond. Both public and private are areas we're interested in. We dig deeper. We try to find out what it's really like to be involved in making change, advocating for it, how you reform, what people's philosophies are in reforming it. As I said, we're live streaming every Wednesday at noon on ThinkTech Hawaii. And later on, you can find these interviews on YouTube and on the Hawaii Educational Policy Center website. We hope you join us as many times as possible. Aloha.
Aloha. Welcome back to Healthcare in Hawaii. I'm Josh Green, ER physician, state senator. Today I'm joined by our incoming Hawaii Medical Association president, Dr. Scott McCaffrey. He's been a terrific guest because he has so much knowledge and so much experience in healthcare, and now has taken a leadership role for our state. So again, thank you for doing this,
Thank you,
Scott.
Dr. Green. I want you to know this is not my first rodeo.
Yes. He's also been the leader at the county level, which is for the county of Honolulu, which really is about 3/4 of our state's population and where our physicians dwell. We had a question in the interim. A gentleman wrote in, when will the American medical system begin to rate physician effectiveness on wellness and disease prevention, not just treatment?
Oh, well, it already is. You know, we've got a number of vehicles. Some are built into the Affordable Care Act, the Obamacare,
Yes.
and others that preceded it. The patient-centered medical home, as well as accountable care organizations, which is supported by and large by the Obama administration's healthcare legislation. Both not only encourage or rate, but also incentivize doctors to spend more time with prevention and wellness and keeping their patient population healthy.
Yes, and I think that
So it's happening, it's coming, and it's going to get bigger.
And yeah, exactly. In addition to that, we think that the Hawaii Medical Association is going to see HMA, our predominant payer, roll out a new program of payment based in large part on prevention, billing for people in a population staying well. So we've been partners with the insurance industry on some issues and sometimes adversaries, but no doubt that that's going on.
Yes.
Now, in our last segment, you were able to speak very eloquently about your concerns about physician-assisted suicide, though you did support the good people who do hospice care and palliative care as colleagues and people who are able to ameliorate suffering. We then moved to medical marijuana, where you called for more research and more participation from the medical community.
And caution.
And
You have
caution.
to be cautious.
So you'll be seeing these dispensaries pop up here like they did in your home state of Colorado before you came to Hawaii. What are you telling physicians about medical marijuana and prescribing? Are you giving them any kind of guidance?
We're trying to get the word out and get the medical community more actively involved. In fact, the Hawaii Medical Association is helping sponsor an upcoming seminar for doctors that will be day-long. We will be covering not only cannabis, but also safe opioid or narcotic prescribing as well.
Yes.
So we want to really engage the medical community. So when someone comes in and says, "Hey doc, what about cannabis?" or, "Doc, you want me to take? I've got this pain, and you're prescribing a Vicodin or a narco,
Right.
opioid type medicine. How can I be sure it's safe? And I don't want to get addicted and so forth." So these are areas that we're really kind of focusing and drilling down on for the doctors of the communities to make sure that they practice best practice.
I'm glad you mentioned that because it came to light that in the last couple of years, the number of deaths from overdose have now in the state of Hawaii exceeded the number of deaths from automobile accidents. Though my understanding is Hawaii is still the lowest in the nation as far as prescribing rates of narcotics. It still seems to be a problem. What's the Hawaii Medical Association doing? I know I've worked with some of your colleagues as part of we've put together kind of a think tank or a group to work on it. Is this a challenge for you?
Absolute challenge, yes. Dr. Scott Miskovich, I know he's worked closely with you trying to develop some best practices for narcotic prescribing.
Yes.
once again, another very powerful tool that if not used properly and you don't keep the brakes on and a bit antithetic to how we were trained 15 years ago before we understood some of the power of particularly some of these new medicines like OxyContin and oxycodone,
Yes.
which are synthetic and much more powerful. We've really changed our orientation because of some rather hard lessons actually we've learned over time. Now that said, I have talked to the head of one of our local hospital systems, large systems emergency department, and I'm happy to report that I asked him, I said, are you seeing a lot of narcotic deaths coming in over the last year and a half? Have you seen a big bump, and is this something we ought to, yell fire about? And he said, no, not really. He said, I read this stuff, but we're sitting down in the emergency room. Mm-hmm. Now, they're not counting the people that go directly to the morgue, yes. By the way. So yeah. That's not a scientific study.
Right.
But the other point that you bring up is that doctors here are only prescribing about 1/2 of the national average of these the narcotic type medications,
yes.
Which says a lot about us already having a good cautious physician population that's dealing with these medicines. That said, we can do better, I'm sure. We need to monitor closely when it comes to narcotics. We're very concerned about the concept of diversion of medications to the street. Mm-hmm. You hear stories about particularly young teenage kids and stuff having pill parties. I'm serious. I mean, this happens where they raid their parents' medicine cabinets, put all these pills into a jar, and just pick them out blind and think that's their definition of a good time. Well, you know how crazy people can get when they're in their late teens and early 20s. Yeah. We know that, and yeah. But the take-home lesson there is that people that are taking medicine legitimately to help control their pain, that are this potentially dangerous and abusive. When you bring your medicine home, folks, put it in a safe place. If you have kids around, don't give them access to it. The same problem, of course, for elderly that get confused. Here's the problem with elderly. They get confused. Their memories are slipping anyway. They'll take their medicine and forget they took it and go back and take it again. And that's what gets them in trouble. So, this is an area we need to do more work on.
I appreciate you saying that, because I think that there are, in an increasing way, a lot of places that the physician community can weigh in. There are national debates about gender issues. There are national debates about medical marijuana. There are national debates about narcotics. There's even a national debate about gun violence and mental illness. And I think that as I've been watching the tragedy recently in Oregon and what preceded in Colorado and across the country, I'm starting to wonder if maybe it isn't time for the physician community and the nursing community and the whole healthcare community in general to take a leadership role and to speak about many of these issues and to help from an analytical perspective and an experiential perspective wade in on these things. What would you say to people about mental illness and guns and violence?
Wow, that might be a whole nother show, you know, but my perspective on this is, this and a lot of other difficult challenges that are kind of plaguing our society, is that the doctors can contribute, and I think we're all willing to, and we're willing to play a leadership role. But these aren't problems we can solve alone. What I would like to do is have our medical association and the AMA also is put our arms around the entirety of the stakeholders that we need to bring in. We need community service organizations. We need insurance companies. We need employers, because they have a great opportunity to educate people through the workplace. That's my occupational background. Right. And the bankers for funding, and we want to make sure our social systems, our social safety nets, like work comp, and some of these other backdrops that are really safety nets are actually that. Yes. We've got that problem here where our work comp safety net slips, and we're wondering why there's so much homeless. Mm-hmm. That's a health issue as well, isn't it?
It is.
But it's more than just a health issue. It's a societal ill, and there's no way any one party's going to solve this. We're going to have to get everybody together. Starting to happen a bit. But we're not going to fix the homeless problem if we can't stop people feeding into it all the time. Right. If we can stop that and analyze it, and I'm not sure enough demographic study has been done on that to really be able to stem that flow. You know, everybody said, well, some of them are on drugs, and some of them are flown here, and some of them are work comp that didn't work. But the sum doesn't help you when you're trying to solve a problem. So we have to deal with that effectively. Then we can then we have a manageable population that we can take care of and get into housing to put an end to this thing.
Yeah, the ER doc in you, I know, is very solutions driven, but I'm glad to see you taking the big perspective, because I worry, one, that some of these problems look so large that no one group, certainly it can't just be politicians or just social workers and case managers taking on these problems. It really does, I believe, have to be a broader community. And interestingly, I think the healthcare community provides that breadth of perspective. You can speak to the shortage of healthcare providers, which includes a shortage of psychiatrists and psychologists. I know you've talked to me on many occasions about the need to have more mental health care in our state to help the individuals that are homeless, to help the individuals that have depression or overdose potential or drug addiction. But I think we need that perspective. It sounds to me like during your presidency, these are some of the challenges you tend to focus on. You talked to me before about bringing a big tent of people together. Would you like to expound on that?
That's just a page out of your playbook, Senator, by the way. You know, because I want, do we have a minute I could talk? I want to just take a moment to commend you as a senator, also a full-time doctor. And I mean, this is the stuff you've been trying to get done, a lot of this stuff, for several years now. And that hasn't been light lifting. You know, the political process, I really been honored to be able to work with you, but I'm also kind of in awe of the difficulty it is at the legislative level to really innovate, or get anything innovative and substantial done, because it's not a forum that lends itself to that. But you know, God bless you for all the work you've been doing and continue to do. You and also Dr. Cragen from the Big Island. Yeah. We need to get more doctors, I think, down at the State House to pitch in on tackling some of these very difficult problems. Until that happens, the Hawaii Medical Association is here to in any way we can to help make you legislators' job more manageable, because you have all of these issues that are coming out. What are there, 200 health bills last session? And of course, you're fortunate enough to be inside and understand a lot of this stuff, but most of our legislators don't. And then there's all these stakeholders coming at them with their perspective from it. I sometimes feel sorry for legislators having to, for them trying to figure out what way to vote and which way to lean. So if we can be there to educate the legislators or the public in general, to help clarify the right direction to go, to really get a handle on some of these problems, we're here for that.
Well, I'll tell you, it's been a fast hour, there's no question, Dr. Scott, but it's exciting to see you become president of the Medical Association. You're, in a very good way, outspoken, you're honest about these key issues like physician-assisted suicide / death with dignity, drug addiction, opioid use, medical marijuana. A lot of people have been reluctant to dive into some of these big issues, but the time is here. These challenges are right at hand, and I think you're going to provide an excellent perspective. So thank you for taking the challenge.
If not now, then when? And if not us, then who?
That's right. So the medical community, it looks like it's fully engaged.
Absolutely.
Okay. Well, thank you again.
Thank you, Senator. It's
been my pleasure. So this has been an interesting 45 minutes, really with a terrific new advocate, not new to the scene because he's already been the leader of the society, the Honolulu Medical Society, but now we have Dr. Scott McCaffrey coming on as Hawaii Medical Association president for the next year. Expect great things. I'm Josh Green, your host of Healthcare in Hawaii.
Bam! Nice job, man. You are Mr. Smooth. You got your job down.
We did this a lot. The time, I'm watching the time, but that was great.